Paul Benton, Managing Director of International at ABHI. Our US Accelerator was formed 8 years ago now. We're just currently recruiting for our eighth cohort to come in. And it's a program of support for UK health technology companies looking to enter and grow in the US market. So the program was formed really with two key primary objectives. How do we de-risk a company's market entry into the US? And how do we help that company scale and grow when they're in the US market? How do we help them catalyze that growth when they're in the US? So I think the program is pretty comprehensive. It provides an opportunity for health tech companies to learn and understand the complexities and challenges related to the US market. It helps them to identify opportunities and validate their market strategy and approach to going stateside. But really importantly, it allows them to make key connections with key opinion leaders, with partners, with health system executives, with insurance companies, with the payer community and group purchasing organizations, just the whole healthcare ecosystem, which we've spent really over a decade now building those relationships with those key players in the market. And it's how we utilize that network to be able to help sort of supercharge the company into the US and scale and build their business there. So I think we've had a whole range of different objectives that companies have when they come into the program. We've had some really great outcomes. So over the period of time that we've run the program, we've tracked now over $150 million worth of business and contracts won that have come from companies that we've helped to introduce to customers in the US and across the country. And we've also tracked now over 75 different pilot studies and clinical trials that those companies have been able to build through the connections that we've been able to make and help make for those businesses across the US. So some really great outcomes in terms of that, and of course, the ongoing learning and development of their kind of black book, if you like, of contacts in the marketplace, which has really helped them with both their education and validation of their approach to the market over that time. So some really positive outcomes that we've had since running the program. We're kicking off now. We're applications are open for companies that would like to be considered for the 2025 program and that cohort. That process closes in January in 2025. So anybody who's interested in learning more and putting in the submitting applications, please do that now. But then we start with the front half of the year, the first few months of the year, with a sort of onboarding sort of period for each of the companies where we help set objectives with them. We start to look at what the key milestones are. We do that sort of needs assessment with each company so that we can understand exactly what each business, which each health tech company wants to get out of their time within the program, and start to make some introductions to our healthcare partners, those health systems that we work most closely with in the US, to start to get some define some projects and pilots and so on with them, and then the program kicks off in earnest from the beginning of April. We start that with a 3-day boot camp, which is held in London, where we bring in a whole raft of different speakers from our mentors network across the US. So those are senior physicians, their chief innovation officers, their CEOs of health systems, to really try and immerse the companies and help them to understand that US market entry and so on. And we have a whole raft of other organizations and so on, payers and group purchasing organizations, other sort of ecosystem players, to really immerse them in that US sort of program and understanding. And then from that, we start with our first market visit, which is taking place to New Jersey. So that will be at the end of April, and that will be a week-long visit, meeting with leadership teams from health systems and really getting under the skin of what that healthcare ecosystem in New Jersey looks like. So a really intensive 5 days, to help companies understand the opportunity there and start to build some of the relationships and so on. Following that, we go to Florida in June, and again we'll be visiting Miami, we'll be visiting Orlando and Jacksonville over the time that we're there, in a similar fashion. We have another visit out to the US in September, which will take in Maryland and Washington DC, and then we finish the year in terms of overseas visits with a trip out to California and Arizona. So specifically taking in Los Angeles and the surrounding Orange County, Irvine area, but also then making the trip over to Arizona, and building some of the relationships with key healthcare delivery partners over there in the city. So a really busy set of market visits that are taking place. A boot camp to start. We have our virtual learning series, which are a series of regular webinars through the year, going into deep dive on different topics and key themes and so on, which provide some good education and validation for companies to help them answer questions that they need to look at. And then we will also be hosting a number of other in-person UK-based events and gatherings through the course of the year as well, with some of those US-based partners that we have who are making trips here to the UK. So really busy in-market, in US program, a really busy virtual program of engagement, and a really busy UK-based program throughout the year to really help sort of supercharge the companies as they go on their US journey. Best thing I can advise is to drop Sophie, my colleague Sophie Green, an email, and arrange a time to have a conversation with her, and then we'll send out all of the information that the companies need to complete applications and so on, and we have a dialogue with each company to determine whether or not they're a good fit for the program and that they'll get good value from what we're doing.